I'm just going to. Okay, so I'm going to kind of go in order, which you talked to me. So the current situation is you're at about 600,000. You're a single provider in a facility. You do a lot of skin substitutes. You want to kind of transition away from skin substitutes to maybe more cash pay. So the first thing you told me is you see 70% like routine nail care. I just wanted to confirm that's what truly. So out of a 24 patient day, you're only seeing maybe like 7 or 8 real like non-corns and callus patients, and the rest of them are routine. Is that right?
Maybe it's closer to 50%.
Okay, 50%. Okay. So, and you're currently seeing, you said about 24 patients a day, 20 to 24, something like that.
Yep, that's right.
Now I work from 8 until 4. So what are your hours? 8 until
8 to
when?
4.
8 to 4. So last patient's at 4. Okay.
Yep.
And you do 20-minute slots?
We do 15-minute slots. We do 30 for our new patients.
Okay. Yeah, we used to do that. We used to do 30 for new patients, 15. Now we just do 20 for everyone.
Okay.
That's just the way we do it. And it kind of all works out. So at your current number, 30 and 15, you're kind of restricted to about 24 to 25 patients a day. If you want to get to 30, you either need to extend your hours, right? Or you need
Yep.
to find a way to add like patients in between,
We've been doing a little bit of that.
so if you want to get to 30, frankly, I can't do 30 in that time period. I can do 24 to 25, and I make well over $1 million in production. So I feel like at your $600,000 number, I think keeping with 24, I think you're going to be able to do that without going up to 30. I don't think going to 30 is going to make you any more money, is what I'm getting at. Okay. So I think having 25 a day, and treating them well, I think is a key. I want to address the elephant in the room, which is the 50% CNC practice. Okay.
Sure.
Did you buy this practice from someone
No, I
or?
just started on my own, and we've just gotten referrals from
Okay.
local primary care.
Yeah. And if you've heard some of the stuff I've talked about, like my main thing would be, is it possible for you to take, maybe you can't do half day like I do. If you've heard, I do a half day on Fridays, like each doctor does a half day, and that's how we do, and we double book. So those 20-minute slots would be 10-minute slots, and then you have a lot of extra time to see the more valuable patients. Have you considered that?
Maybe explain that to me a little bit more.
Yep. So I used to see patients whenever they wanted to be seen for what I call routine care,
Yeah.
calluses, corns, and nails. Okay.
Yeah.
So what we used to do is we used to just kind of put them interspersed throughout our schedule. The problem is if you have a busy day and you're treating a plantar fasciitis patient and they want to do shockwave the same day, you run really far behind. And the nail care patients take 5 or 10 minutes. And I was doing all the nail care. Okay.
Yeah.
So we've transitioned that. And so what I used to do is we said, okay, well, let's put all this nail care on one day of the week. Okay. So I was doing every Friday, and some people call it Toenail Tuesday. And what you'll find is that you can put all the patients on one day, and it does two things. Number one, it restricts your availability. So if they can only see you Tuesday for nail care, they're all going to come and see you Tuesday for nail care. Now there'll be a few that can't, and you'll say, I'm sorry, that's just the way we do things here. Okay. And so you put everyone on the same day. It takes a little bit to do this transition. And then, so on those nail care days, you're doing, in my opinion, you're doing nail care. You're doing your once a year around their birthday. So usually if their birthday is in September, so in August, September, or October, I'm doing a comprehensive diabetic foot exam. That's your E&M visit. And then you're doing ABIs. And then you're doing, if you do diabetic shoes, you can do diabetic shoes. So this makes something that's not very profitable into something that's very profitable. Okay. That's the first thing.
Okay.
The second thing is, we're kind of helping out here. Long term, it's not going to work to bill E&Ms when you're doing nail care. Okay.
Yeah, I know. I've run into that for a couple of patients, and I've had to discuss that with them.
Yeah. And so there's two issues. One, you might not know how to bill. That
Yeah.
might be an issue. And the second thing is you want to be nice.
Yeah.
Okay. So currently what you're doing is you're billing E&Ms, and I don't know if the F word is what you're doing is fraud. I don't know if it's that, but you have to be careful. Okay. So you bill what you do, and all day long, my patients pay me $75 to do nail care. Okay, all day long. The way we do it, I know we're going to get into the billing here, but for most of my patients, if they have type 2 diabetes with PVD, that's documented as class findings. If they have diabetes with neuropathy, that's documented by their doctor. If they have rheumatoid arthritis, if they have idiopathic neuropathy diagnosed by their doctor, if they have all these things, they can usually be covered for nail care. Thickened nails are easier because of pain. I'm not going to go into all the deals. I'm not a billing expert. Thinner nails, a lot of times, if we get paid for the 1 to 5, we don't even charge for the trimming of the remainder. So I as well give away those other ones, right? So they pay for 1 to 5, or the insurance pays for 1 to 5. The others I give away. But if they have calluses that aren't covered, right, they pay $75 for the callus all day long. Okay. And so they're paying me $75 every time they come in. So the nails are covered, but the calluses aren't. And maybe I won't do it every single time because it might not be painful every single time. So
yeah, one thing I've run into that with that is I worked at a practice that did that, and patients became very frustrated. They said, well, why is my insurance covering one part but not covering another part of my visit? And then you get into a whole discussion at the front about, what the insurance policy specifically covers and doesn't. And I felt bad, upsetting the patients over, they felt like they're paying a copay if they have one, and they should be able, or they're paying a premium for their Advantage plan or whatever, and they feel like they should be able to get all the services covered under their insurance, and it just creates frustration on their end. And I feel bad, piecemealing it out like that. So I felt like the best thing to do for them was just treat everyone the same across the board. And I understand what you're saying though, is like I have patients that come in and they truthfully don't even need nail debridement. It's just nail trimming, and it's specifically not covered under their policy. And their only reason they need help with it is they can't reach. There's no pain, there's no contracture, no vasculopathy. And I tell them, that's explicitly not covered under your policy. So you need to call me when it becomes painful, or if you have, signs of tinea or discoloration that you need evaluated. I'm happy to do the trimming for free, but we can't bill the insurance for nail trimming alone. And that's the trouble I've run into with a few of them.
Okay, so let's unpack that. So
Yeah.
nail trimming, I agree as well, isn't covered. And I say, Mrs. Jones, it's not covered under your policy. You have to pay me $75.
Yeah.
I never bill an office visit for when I'm doing it. Like if they have an office visit that I'm truly evaluating and managing it, maybe the first time I might say, okay, I'm going to do an E&M here and I'm going to trim your nails. But I plant the seed. I say, Mrs. Jones, I don't think this is covered under your policy. I don't know what the other doctor did for you with a lot of empathy and care. And I said, $75, it's not going to break the bank 4 times a year. And they're like, oh yeah, it won't. Okay. And so you'll just get ready to pay next time. And I always try to throw it on their doctor. I say, we're going to send something called a systemic over to your doctor. And all that does is it asks your doctor what conditions you have. And I say, and they're going to send that back and they're going to tell me what you have. And if it's covered, I'll do it. And I'm kind of young, kind of like you are. I'm kind of young and I got to do this a lot of years. And I don't want to get in trouble. Maybe your other doctor, they did it, but they're retired now or whatever. It's more convenient to see me. And so that's for the trimming. For the calluses, the same thing. Insurance doesn't cover calluses just because they're even hurting. They don't cover it. And, unfortunately, and let me tell you, just in kindness, to you, you have probably maybe a spouse and family, and you're just taking that money away from them every single month by giving it to your patients. And you have to get comfortable at talking about this with them. Like all of them should be paying you. And you might say, you're gonna have to set a line in the sand if you want to get to that $1 million mark, and you just can't give it away. You just can't give it.
So our cash patients pay $80, and we don't piecemeal out corns versus calluses versus nails. It's all in one for what we call our at-risk comprehensive exams that we're doing, and I include everything in that. But when they have insurance coverage, I try my best to stick within the confines of what their insurance will allow. So we specifically do time-based billing for those patients, and I typically am billing a 99212
But you can't
for
do that
them.
every time. You can't do that every 3 months.
Yeah, so I've told those patients that I can't schedule them for a routine visit, and they happen to have painful nails on that day every 3 months. And happen to need me to evaluate their, oh, yep, the nails are still dystrophic. I got to help you with that because it's causing your pain. So some of them have tinea that I'm helping manage, and I'm reevaluating them for refills of their Lamisil or things like that. And I feel like that's not fraudulent. I think that's within the confines of their insurance policy. But yeah, I agree. If they're coming in for a callus that pops up in the same spot every 3 months, then maybe that's something where we need to talk to them about what the guidelines are under their Medicare policy.
Yeah, I think you could talk to them. I think in the beginning we're scared of telling people what things cost. So,
Sure.
and I'm just, being nice about this, but if you have a hard time telling someone it's $75, you're gonna
Yeah.
have a much harder time selling your shockwave for 250 or 300, which is $1,500 for the 6 sessions. So it's
Yeah.
something you have to get good at. Okay.
Absolutely.
Um, so now let's talk about shockwave. Which device are you gonna demo?
We're demoing the Chattanooga Focus Shockwave. That's an electromagnetic, I believe. I have some talk. I know you recommended stores, which I think our vendor is CureMedics, and so they're gonna set up a lunch with us to talk about theirs. I've met with StemWave and OmniWave. I think I have a SoftWave one as well. Those are all electro hydraulic, I believe.
Yep.
So those are a lot more expensive. And then Zimmer is coming out with a piezo electric device
Yep.
that they want to come demo for us too. So we'll see. But by the end of the year, I'd like to choose one of them. And I know there's some tax advantages for equipment purchases I need to talk to my accountant about as well.
Yeah, there's tax advantages. And it's really like my best recommendation would be to go to there's the American Shockwave Society now. I would go to one of the courses, right?
Okay.
That's the easiest use of your time.
Okay.
All the Chattanooga is a cheapened Storts. That's all it is. It's the same technology. They probably buy it from Storts. It's a
Yeah,
Storts device, but you're not paying full price.
I
Okay.
see.
Chattanooga, you got either the focused or the radial. They have both of them. Most people start with a radial device. So if I were
I
to
know.
give you, I would start with a radial device till you get used to it, till you get used to selling it, and then you would add focus. That's what I would do. If you only want one device, then you're going to buy the SoftWave. SoftWave has both. It's a lot more expensive, but it has both. So if you're tight on money, you're going to do the radial first or the Chattanooga cheapened version of it. That's kind of my opinion.
Okay.
Um, I'm I made this mistake in the past, and so I'm just trying to help you out.
Yep.
Like, like I know it's money, and I know you have a practice, and I know all these other things, but like, you are cheap if you go cheap.
Yeah.
I'm sorry to say that, but like if I could do it over again, you just want to go high class.
Yeah.
You want to go expensive, and you want to learn how to charge a lot. That's the way because you charge patients more, they're more invested. You have a good device, good technology, good training. Like no one has better training than the Storts. The CureMedics. They do a really good job at that. And these conferences are how you learn about it. So yes, trial them, but frankly, they're going to try to do a puppy dog close. They're going to let you use it. You try it on a few patients, and then you're going to use whatever one you're used to. So if I were you, I would start with radial, which is a storage device, get used to it, and then buy the focus later on. That's what I would do. So that would be the easiest thing.
I have the money for the focused, and I've been leaning towards that after reading the stuff that I've read so far. I did demo them in person on myself, and I found the focus was a lot more impressive. It's a much steeper upfront cost. I have a friend who bought a used radial device for $5,000, and he charges 150 or $200 a session for that. And for me, it's hard to justify charging someone over $100 even for a radial treatment when the focus seems like such a bigger investment on my end of things, that to me is easier to justify asking someone to spend $200 on. And I
so
guess some of the evidence is inconclusive or shows that maybe radial might even outperform focus for some applications on the foot and ankle. And I think you had talked about like for toe pathology for fractures or non-union things like that, it might be harder with the focus device. But to me, the technology just makes more
harder with
sense.
radial.
And
Harder with radial. Harder with radial.
what's that?
It's harder with radial. Focused penetrates more and it's better for fractures. But how much fracture work do I do? I do more now. You
Yeah,
80% you want with the radial machine. If you can buy one, you can buy the focus. That's fine. But let me
yeah,
explain. What patients are paying for is results. They're not paying for how much your
sure,
investment was.
absolutely.
Like, and you invested 500,000 in or whatever you invested in medical school. They're paying for like your expertise at getting them better, not like the technology per se. So like And so we used to charge for radial 200 a session. Okay.
Uh-huh.
And so now we charge 250 and they're getting radial and a non-radial device. So that's how we do it now. They're charging 250 a session, and all of my patients get 6 sessions.
I
So
see.
it's like, but not all of my partners do that. Okay, this is the way I do it. I like to be
Mm.
around by the 5th or 6th session when they start to get better, because I feel like, wow, then they're like, wow, this really works, and it does. So
You're never offering just 1 or 2 treatments then. You always have your patients do the full 6 treatments.
yeah, I've never done 1 or 2. What the research shows is you can't see anything with 1 or 2, and you don't see it for 6 weeks anyway.
Yeah.
Okay, so no, 1 or 2 never. 1 or 2
Okay.
never. This takes practice.
Yeah.
It takes practice to get the gumption to say that. And
Yeah.
like, if you're in California, I'm assuming people, I'm in Massachusetts, and everyone says, oh, they're more, affluent people. It's not about affluence. It's about your belief in it. So if you don't believe it, what I would say, and I'm just teaching you about this, if you don't
Yeah.
believe it, I would give it for free versus
Yeah.
discounting. So I
Yeah.
would give it for free for a number of patients versus discounting it. So because that free, then you're going to learn how to do it. You're going to say, hey, I'm going to do this for free for these 6 sessions, and then I want you to give me a good review. We can do a video. You can use that then for your content for the
Mhm.
future. But like, same thing with ultrasound. I gave it away for free until I learned. So give away shockwave for free. Give it so many sessions till you learn how to use the thing. So let them leave the device with you, do it on patients, learn how to explain it, give it for free, get the reviews, and then you can buy it later. That's what I would kind of recommend.
Yeah.
Um, What else? You want to unpack shockwave anymore, or is that okay?
No, I think that's helpful. I mean, I'm still kind of feeling the same about what I want to do with it. I think, other than I like this idea of doing it maybe for free instead of discounted. It's hard for me because I've already talked to some patients about, like, if that are interested. If we have good feedback, well, my goal was to do the trial day, the demo day, and then see if they had improvement after a single treatment, and then that might influence my decision whether or not to buy that device. But I guess I can't really expect that.
They're not going to see anything that day. And the real hard thing
Well,
about
not that day, but on follow up. But yeah.
they're not going to feel anything the week later.
Yeah. Okay, that's helpful.
A lot of it's, and this is a challenge with shockwave with people starting out. Like, it's expectation. Like, you're setting
Yeah.
expectations. And so
Yeah.
I try to set the expectations low, and I try to over satisfy. So like, I'll tell them, hey, you might feel a little bit at the 5th or 6th session. And then at the 6-week follow-up, I'm looking for 30 to 40% improvement. And then at the 6-week follow-up, 30 to 40. And then at the 12-week follow-up, maybe 50 to 60. So I
I see.
under set expectations for them.
I see.
And I always over deliver for that. So um
Okay, that's helpful.
and I'm in agreement. I would give it away for free versus, and you can ask them, hey, could you just leave this here with me for a few weeks so I can try it out, and then try it out on everyone.
I
Like,
see.
do it on every, if you're not going to do all 6 sessions, just do it on everyone, just so you can learn how to explain it and things like that. Okay. I don't know. I don't do skin substitutes, so I can't really help you with that.
No, that's fine.
How to digress around there. Reducing low paying insurance. So what we did is we progressively opted out of insurances. So Medicaid is one that we have here. It's called Mass Health. So a number of years ago, we just said, we're not going to take it anymore, because it actually cost us more to see the patient than we got reimbursed. Like, when I used to see Medicaid, I used to only do procedures on those patients. So every patient was getting a procedure, and then I kind of wouldn't have them come back to make it profitable. We've just kind of stopped seeing them. And you sometimes think, well, but the doctor's sending over their Blue Cross. What happens if they have a Medicaid? Well, they kind of adjusted, and they kind of know that. And so
I
it
see.
just it takes courage. But the best thing you can do is these really low paying. And I think we opted out of what's the other one that's really bad? Forgot. Yeah, there's a couple of other ones too that we just kind of progressively opted out, and it's fine. That's what I would do if I were you. I would just stop seeing them.
Okay.
It takes courage to do that. Once again, you're like, oh gosh, what am I going to tell them? Well, I'm sorry, you can pay cash. And so I do agree. We have in my Practice Mastery Academy, I have all the written down prices for my fee schedule. And so it's like level 3 visit 150, level 4 visit 200, if I do a procedure, it knocks down the office visits by $50, and then I have the procedure for matrixectomy, ingrown toenail, the most common ones, cortisone injection, shockwave, stuff like that. So I have a cash pay schedule. We don't publish it on our website. I know some people publish it on their website, but our staff know. And so when they come in, if they get x-rays, it's all written on there, the cash pay stuff. I'm a big, another thing you talked about, pricing orthotics. There's no incentive to be the lowest priced doctor. No incentive whatsoever. So if anything, I would recommend you be the highest price. So you find what everyone is charging and then charge 20% more.
Okay. Some people charge quite a bit here, like $700 for a pair.
Okay, so start there. Yep, that's what I would charge then, at least.
Okay.
Why not? Why not?
Because I had people coming in that say they, they went to Good Feet store and they spent like $600. And I just feel bad because people are spending so much money. And for me, I don't want it to turn into a money grab for us. For me, it's really about making them better. So I offer a satisfaction guarantee to pay $100 deposit. I offer revisions, adjustments for free until we get it dialed in. And then we also do a lifetime warranty on wear and tear. So I'll buy them a free pair if they wear them out. And I still think we still come out in net positive. And at the end of the day, we leave with a free review. I don't want people to leave us negative feedback because we have what they consider to be outrageous prices for certain things.
Okay. So how much do you charge?
400.
Okay. Okay. So do you have a family and kids yet?
No kids, just our dog.
Yeah, just your dog. Okay. So if you're okay, you were on the phone because we want to bring it from 600,000 to 1 million,
Yeah.
right?
Yeah.
And so do you want my opinion?
Sure. Yeah. I mean, that's what we're here for.
Okay. You can at least double your price. And if you're
Okay.
really concerned about that, you could send out an email to your patients, say, hey, just so you know, prices have been 400 for a long time. Due to rising costs, I'm going to increase my price. If you want to get locked in, you can do it right now for the next month, but then the prices are going to go up. Okay. And so I would raise it at least to the $700 mark. We charge 600. So if you want to be like us, you can raise it to the 600 mark. It's fine.
Yeah.
My thought is, for you specifically, either you don't charge what it's worth because you're not very good at making orthotics, okay? Or you're not confident in your orthotics. Because if you're confident in your orthotics, okay, they work for your patients and your patients are going to love them, okay?
Yeah.
And so I agree. I also stick behind my orthotics, right?
Yeah.
But so all of my orthotics, if they have to get a new pair, I don't charge them. We use forward motion. They'll send them a brand new pair. I do adjustments, and I say they usually last about 5 years.
Mm-hmm.
Okay, that's how I do it. So lifetime, is kind of a long time, but ours as well. They're very pleased and they pay us $600 all the time. And then when they pick up the orthotic, they get a little handout that offers a second pair for $200 off, so they can get a second pair or as many as they want for $400. Okay.
Yeah, so I offer $100 off for future pairs, and a lot of people take us up on that.
Yeah.
But I know and we have chatted about increasing our prices just because I found out that we are the lowest price in the area, so I think it's reasonable. In general, a lot of our retail stuff, we've figured we try to double the price of what it costs us to purchase it. Do you guys do off the shelf or over the counter type too?
No, we don't.
Just custom only?
Yeah.
Okay.
And
I mean, we do pretty high volume of Power Step
yeah.
off the shelf too, which is a lower amount total, but a similar margin. We double or triple the money that we invest.
And so I'm just hitting on the same
Yeah.
button here. So the reason we don't offer lower value things is first of all because for the younger doctors it would be easier for them. It's a lot more unintrusive to say it's $60 versus $600, right?
Yeah.
And they're lazy and they're not confident, and then they're just going to offer the $60 one.
Yeah.
Okay. And in the way I explain it, let's talk about Good Feet. Okay. So I always use Good Feet as an anchor. So that means I say, we recommend custom orthotics. By the way, don't go to the Good Feet store. It's about $2,000. That's called anchoring. You anchor high. Okay. And they're over the counter. They're not custom. And so when we do them, they last. So my spiel is they take about 3 weeks to make. They last over 5 years. They're not covered by insurance, but they're $600. okay? And we stick behind the orthotics. That's all I say. I say my patients have 3 questions. How long do they last? You know, they have 3 questions, like how long do they last? How much do they cost? And why doesn't insurance cover them? And I say, you know, and insurance is just covering less and less. You can use your flex spending, but this is how much they are.
Yeah.
And it takes confidence to go from that 300 level. So you're going to have to change as a person to go from charging 300 to charging 600 because you need to change.
Yeah, no,
You
that's fair.
internally, your belief system has to change. Okay.
Yeah.
And I'm trying to help you here. And this is
No,
something
I get it. No, I appreciate
maybe
it.
maybe you have no one else. And so, because if you're charging $600, so what when they come into me, I say, okay, Mrs. Jones, we're going to need to do, we have plantar fasciitis, you have bilateral shockwave, that's going to be $3,000. And at the 3rd visit, we're going to do orthotics, which are going to be $600. And they say, well, when can I get started?
Okay.
And so it takes practice to say that without a smile, right? Because in your opinion, that doesn't fit your wallet,
Yeah.
right? You wouldn't
True.
do that.
No, I wouldn't.
But but you can't treat patients as you. It's the platinum rule. You treat them as they want to be treated. So they want to get better. So if you struggled with plantar fasciitis for months and months and months and you're not getting better, you would do whatever you could.
I have people offering to pay more than what we charge for a lot of things.
So I'm trying to coach you along here. So that would be the orthotic thing. And we talked about in reviews. Okay, we use Swell for reviews. You can use whatever
Yeah, you
you want.
mentioned Swell.
Yeah, you can use whatever you want. We have 4 doctors. We pay $600 a month, but we have like thousands of reviews more than anyone else. We have a
Yeah.
system. And so you don't have to use Swell. You can use anyone that you want, but it has to be every patient that comes in has to get a text message to give them a review because people are going to come to you because of the reviews. So
Yeah, we do that for all our new patients. I don't know if we should be doing for some follow-up ones that have good
do it for
experiences.
everyone. Like reviews are gold.
Yeah,
And
that's true.
don't worry about the bad reviews. You got to have bad reviews. I like bad reviews
Yeah,
because otherwise they're going to think you're like gatekeeping and like.
sure. No, that's fair too.
So I think we unpacked a lot. I got to go see patients again. I hope that was beneficial.
Yeah, I got to run too. But yeah, I appreciate your time, Don. I'll have to set up another meeting to
Yeah,
follow
we'll
up
set
with
up
you.
another one. I'd be happy to help. And if you need anything else, let me know.